Welcome to our test taking strategies quick review presented by Apex Nursing Academy. Today we're going to be talking about test taking strategies that are good for nursing school exams and NCLEX. Now, nursing exams really want you to apply your nursing knowledge and use your clinical judgment by way of cognitive skills. So, what are cognitive skills and how do you use these cognitive skills to answer test questions? Cognitive skills are really a set of skills developed by the National Council of State Board of Nursing. By the way, these are the people who develop our NCLEX exam, in which we all have to take the NCLEX exam to get our nursing license, right? So, this set of cognitive skills are recognize cues, analyze cues, prioritize hypotheses, generate solutions, take action, and evaluate outcomes. Today, we're just going to talk about recognizing cues in a test question. When you recognize cues, you really just want to identify and hone in on relevant and key information. You want to identify significant data that's in the question. So let's practice looking at a NCLEX style text question and recognizing cues. The nurse is teaching a client with hypertension about choosing low sodium foods. The nurse should plan to teach the client to limit intake of which food. Now, if you remember from previous test taking strategies, our number one test taking strategy is to repeat the STEM. Repeat the question and start looking for that significant data. Do that before you go down into the options. So we're just going to read our STEM, read our question again. The nurse is teaching a client with hypertension about choosing low sodium foods. The nurse should plan to teach the client to limit intake of which food. So, part of using your cognitive skills is recognizing these cues that are in the stem of your question. The nurse is teaching a client with hypertension about choosing low sodium foods. The nurse should plan to teach the client to limit intake of which food. So here I've highlighted the key words in this stem and in this question, which is hypertension. We have a client with hypertension choosing low sodium foods, and the nurse is going to plan to teach the client to limit intake of which food. So, this is how you begin to pull that significant data, recognize cues, in other words, to get you thinking about what is the question asking you, what is the subject of the STEM, what's going on that's going to lead me to the right answer. So, again, today we just wanted to review recognizing cues in a test question. Next time, we'll look into analyzing cues. We're going to analyze, what does it mean to have a hypertensive client? What does it mean about low sodium foods? And what is the question asking me? So, as you begin to develop your cognitive skills, you will create a much better way to answer your nursing school questions and ultimately NCLEX questions, which is what you want to do, right? You want to get to where you pass NCLEX and get your nursing license. So stay tuned for more test taking strategies from Apex Nursing Academy. You guys have a great day and see you next time.